Bismillah ar-Rahman ar-Rahim. Hello, my friends and my colleagues and my students and my fans everywhere. This is a continuation of my series on management of acute abdomen or acute abdominal pain. Now come to the last steps of management after I mentioned the pathobiology and the pathogenesis and the causes and different types of abdominal pain and the different causes, the surgical, the medical, the gynecologic causes, and the different subgroups. Now I will come to the management. Management starts with the diagnostic tools. What are the diagnostic tools which we use for the differential diagnosis or to reach to the underlying cause of acute abdomen? Because the most important step in the management of acute abdomen is to address the cause of the acute abdomen or the underlying disease or the underlying pathology which is causing the acute abdominal pain. Because treatment of acute abdomen is treatment of the cause. To recognize the cause, to address the cause, and then to treat it, whether it is surgical, traumatic, inflammatory, infective, the three common surgical, the traumatic abdominal pain related to body trauma and abdominal trauma, whether blunt trauma or sharp traumas due to knives or due to shots, that's gunshots or pistol shots, or blunt trauma due to blunt friction of the abdomen in car accidents. This is traumatic abdominal pain, and this is a surgical cause of abdominal pain, and this is managed surgery or by surgical specialist in general surgery or in abdominal surgery. Because we all know that all traumatology cases, they are handled by multidisciplinary surgical approach, including the abdominal surgeon, thoracic surgeon, neurosurgeon, and orthopedic surgeon, in addition to intensivist. So it's treatment of the underlying cause. To reach to the exact cause or to the final diagnosis or the definitive diagnosis of acute abdomen, we have to do, after of course proper history taking, which is very important, and then number two, thorough physical examination, clinical examination, general and systemic examination, and then local examination of the abdomen by inspection, palpation, percussion, and auscultation, etc. Then we come to the third step, which is investigations, and the investigations which are offered to for the differential diagnosis and to reach the final diagnosis in acute abdomen include, number one, blood tests, and this include hematology, that is full blood count, and the ESR. And of course, from full blood count, we can detect or pinpoint important parameters which point to the underlying disease, like anemia in cases of hemorrhages, if there is hemorrhage due to rupture or due to surgical cause, and also changes in the white blood cells, in the total white blood count or in the differential count. It depends on the cause. Changes in the platelets, changes in the coagulation parameters, coagulation profile. So the CBC is very important in the differential diagnosis of acute abdomen, especially in traumatic, inflammatory, and infective and other causes, as I mentioned, in blood diseases causing acute abdomen, or other causes like vascular causes of abdominal pain. So CBC is very important and is number one test for the evaluation of acute abdomen, CBC or FBC, full blood count. Now, after that, we proceed to other blood chemistry, including liver functions, to detect any abnormality in the liver and the biliary system, serum bilirubin, serum hepatic enzymes, the ALT and AST, the 5-nucleotase, the alkaline phosphatase, plasma proteins, and then renal function tests are very important. And then, of course, urine analysis is very important to detect hematuria, macroscopic hematuria related to renal stones, or to detect proteinuria related to other glomerular injuries and other abnormalities in the renal tract. Also, stool examination is very important, especially for detection of intestinal infections, for detection of blood in the stools, for detection of pus in cases of bacterial infections of the intestine, and also for detection of inflammatory bowel disease. That's ulcerative colitis and Crohn's disease. The simplest number one routine test is stool examination. It can guide us to different important diagnostic possibilities. So stool examination is important, urine examination is important, kidney function tests very important, serology sometimes important also. Many serological tests might help, especially for infections, viral serology, including, of course, serology for viral hepatitis as a cause of acute hepatitis, which might be the cause of acute abdomen. Also, different tests for endocrine diseases, for the thyroid, for the adrenal, for the parathyroid, serum calcium, thyroid function test, the free T3, free T4, TSH, serum sodium, serum potassium to detect any problems related to the adrenal gland. We may proceed to specific hormonal assays also, depending on the suspected underlying pathology, which depends on which varies from individual to individual. So this is the blood test which we should do them. And then after that we proceed to radiological investigations, starting with a plain radiograph, which can detect intestinal obstruction with air and fluid levels, or for detection of radio-opaque stones, or for detection of calcification in organs related to metabolic diseases and abnormalities. The plain radiograph is very important and may be very useful in the differential diagnosis, plain radiography. And then after that, abdominal ultrasound is also a basic primary tool in the diagnostic evaluation, the abdominal ultrasound. And then after that we can proceed to abdominal CT with or without contrast, whether intravenous contrast or with barium, CT with barium meal, or CT with barium enema, or CT with intravenous contrast. Also abdominal MRI after that, after the CT, might also be very useful in detection of the underlying disease. Also we might use interventional radiography, or including the CT angio or contrast enhanced CT and duplex ultrasound for detection of vascular problems which might be the cause of acute abdomen, like superior mesenteric occlusion, inferior mesenteric occlusion. This needs specific interventional radiological techniques, including the CT with angio or CT angio, especially important for diagnosis of aortic dissection and disturbed aortic aneurysm, conventional angiography, duplex also might be duplex ultrasound might be helpful in the diagnosis of other vascular diseases causing acute abdomen. And then we might also need radioisotope scans, and might need also other specific radiologic techniques for detection, for example, of colonic angiodysplasia or abdominal tumors or abdominal cancers. So radioisotope scans might be needed also in some selected cases with rare diseases of the gut, whether vascular causes or neoplastic causes. And then after the radiology, we might need endoscopy, and the endoscopy might for abdominal pain might be for diagnostic purposes, or also might be for therapeutic purposes, what we call therapeutic endoscopy. So diagnostic endoscopy and therapeutic endoscopy is also mandatory for differential diagnosis of for the investigation and differential diagnosis of acute abdomen, upper endoscopy and lower endoscopy. Endoscopy with ultrasound, that's transendoscopic ultrasound, and this combination of endoscopy with ultrasound for diagnosis and for treatment of abdominal pain. And then after that, we might need also, after the endoscopy, we might need a laparoscopy, which might help. And then exploration is the last resort to detect the exact cause of acute abdomen, especially in surgical causes of acute abdomen. We say exploratory laparotomy, that is opening of the abdomen to find the cause, especially in surgical causes of acute abdomen. And of course also in including traumatic abdominal pain. This is the diagnostic evaluation. And then for the treatment of acute abdomen, it is number one, the most important is treatment of the cause. If it is surgical, we have to surgical cause like treatment of appendicitis by appendectomy or cholecystectomy, whether laparoscopic or open cholecystectomy for chronic cholecystitis with acute exacerbations, or other biliary stone problems. So it's for gallstone disease, for example. So this is the surgery for surgical causes. As for medical causes of acute abdomen, the most commonly used medication, of course, number one is treatment of the cause, specific treatment of the specific underlying medical cause, endocrine or metabolic or hematologic cause or neurological causes or infections or inflammatory pathologies. We have to give specific treatment. And then non-specific medications, which we can use them for medical acute abdomen, are of course pain medications. And the commonest pain medication to be given is paracetamol, intravenous paracetamol, or sometimes narcotic analgesics. This simple analgesic is paracetamol, or narcotic analgesics, especially commonly we give tramadol. We can give it to alleviate non-surgical acute abdomen, all cause of non-surgical acute abdomen. Tramadol injection can help with paracetamol. Also, we can use other narcotic analgesics like codeine, but try to avoid morphine because it might cause sphincter of Oddi spasm, which increase and make the pain more progressive, especially in patients with gallbladder disease, and it will cause prolonged and severe epigastric pain. So avoid morphia in acute abdomen as a narcotic analgesic, but others can be used. As I mentioned, tramadol is a weak opioid analgesic, also codeine, petidine, but avoid morphia. Paracetamol also can be given. Spasmolytics like Pascopan and hyoscine can be given, especially for crampy abdominal pain related to obstruction of hollow viscous, small intestinal pain. In patients with intestinal infections and abdominal colics, we can give Pascopan, IV or IM. Also, it can be useful for renal tract obstruction by calculi. Also, it might be helpful, the Pascopan, especially if given in combination with hydration, good hydration, and small dose of Lasix. It can help to relieve the pain of renal colics and other ureteric causes of abdominal pain. So spasmolytics like Pascopan and hyoscine. So paracetamol, tramadol, hyoscine, Pascopan, these are all medications. Avoid morphia. Avoid also improper use of non-steroidal anti-inflammatory drugs for pain relief like Brufen and Voltaren. Better to avoid them. Avoid Brufen, avoid Voltaren, because they have side effects and they are not useful pain killers. So these are the main pain medications or painkillers. We use them in acute abdomen for symptomatic relief. We have to use them with small doses and for short periods of time, and when necessary only, and to avoid abuse of them. Also, we can use other medicines like antibiotics in infections of the abdomen, abdominal infections with acute abdominal pain. So antibiotics also. Most commonly we use intravenous antibiotics, especially in moderate or severe abdominal infections, so including intestinal infections. So oral and parenteral antibiotics are among the medications used in acute abdomen in suspicious infectious causes of acute abdomen, antibiotics. Other specific medications depend on the specific underlying cause of the acute abdomen. Also proper surgery for appendix, surgery for the gallbladder, wise use of hydration, especially in acute hemorrhagic pancreatitis with shock. We have to hydrate the patient properly. We have to rest. Sometimes to rest the gut is an important therapeutic modality. Stop eating and just give in specific cases small amounts of easily digestive food. After resting the bowel rest for a few days, which is commonly used in acute hemorrhagic pancreatitis, in order to calm down the pancreas and put the gut and the accessory glands, including the pancreas, under rest. So stop eating is sometimes a medication or is a therapeutic option in patients with acute abdomen. And after stopping food and stopping eating, later on after a few days, we can start giving small amounts of easily digestive foods like crackers or biscuits or soft foods like yogurt and other soft or then semi-solid foods and so on. And then slowly we go back to the normal eating pattern and the normal regular eating pattern. But this is also considered among the therapeutic modalities used in acute abdomen. Good hydration is important in many cases of acute abdomen, even up to intravenous hydration, and keeping the patient hydrated, as for example in patients with acute hemorrhagic pancreatitis in shock. Also, sometimes using heat therapy or what we call heat therapy, and putting warm water bottles on the abdomen, it might help in small, milder cases. This is generally the different medicines and therapeutic options we use in acute abdomen, but the most important is to address the underlying pathology and treat the cause, whether surgical, medical, or as I mentioned before, or gynecologic causes. Thank you so much, and I will see you in my next presentations. I wish for all of you my best regards, and I wish for all of you safety and being peaceful. Have a nice day, all of you.